A hospital may hold dozens, even hundreds of seriously ill heart patients at a time. Keeping track of all of them requires a high-tech touch. On today's Heart of the Matter, how that equipment gets people the care they need.
A room of trained technicians follow the heartbeats of seriously ill patients in Baptist Memorial Hospital, Memphis. They're using a recently installed cardiac monitoring system that cost $2.5 million and replaces an older system.
This is our cardiac monitoring room, and they are monitoring patients in the hospital's heart rhythm by radio waves. And we basically have 350 channels of radio waves that we use to monitor the patient's hearts. In our cardiac services, all the patients are monitored.
Stubblefield says the new technology avoids potential interference because it includes protected bandwidth for the radio signals between the patient rooms and the monitors. Heart specialists who can't be at the hospital 24 hours a day like the expanded ability the new monitors provide.
This is really important, especially from a cardiologist standpoint. A lot of our patients are prone to having arrhythmias, and so it's nice to know what's going on so we can help adjust medications.
The computer screens provide real-time images of how patients are doing. The hardware can also store that information, allowing physicians to review up to 72 hours of patients' rhythms. That can show them changes in people's conditions and let them know how adjustments in medications are working.
The system that we replaced was roughly about 15 to 20 years old. So if you can think about your cell phone and how when you get upgrades on your cell phone it has better functionality, well, this is similar.
Plans for the upgrade started last summer, with training starting at the beginning of the year. When there's something out of the ordinary, an alarm goes off, alerting the technicians who can then contact medical staff in the part of the hospital where the patient is. Because of the training, techs can filter out low-level versus more important warnings.
Some of the alarms that are in the system, and what you're hearing right now are some of the medium-level alarms, which just means the monitor tech needs to look and see if anything needs attended to. And then we have some critical alarms. If a patient should go into VTAC or ventricular fibrillation, that is a different sounding alarm that means immediate response.
Another function allows remote monitoring on terminals in parts of the hospital where patients are being treated. That includes access in patient rooms as well. While the monitors are designed to track cardiac patients, other patients can benefit as well from the around-the-clock care.
Also, patients that undergo surgery, heart surgery, thoracic surgery, or any other types of surgery, a lot of these patients are high risk for arrhythmias post-op. And by having this high-tech monitoring system, we can accurately monitor these patients closely.
More improvements are coming to the system. As Baptist upgrades its medical record system, doctors will be able to use smartphones and tablet apps to see the rhythms from wherever they are and not have to rely on descriptions from technicians or nurses. For Smart Medicine, I'm Doug Johnson.